Hello, everybody, and welcome to the second Colorectal Cancer Screening Summit. My name is Tamsin Rose, and I have the privilege today to be your moderator. And I was also the moderator last year, so it will be really interesting for me, as well as you, to see the progress in the last 12 months. Just a few housekeeping points to remind us all on how the system works. This is a Zoom webinar process, which means that you, the audience, are on mute, that your camera is switched off, except for the speakers and panelists. This meeting will be recorded so that we can have an accurate report that will be shared with you afterwards. The recordings themselves will be found on the Digestive Cancers Europe website, and we'll be putting links on social media together with the meeting report. And of course, on social media, if you are on Twitter and if you are tweeting your messages and your information, this is the hashtag we invite you to use so that we can find it afterwards and there is a consistent series of messages. That's CRC Screening Summit, all in one word as a hashtag. I'm delighted now to introduce the CEO of Digestive Cancers Europe, who will give us an introduction, and that's Zorana Maravic. Zorana, the floor is yours. Welcome.
Thank you, Tamsin. Good morning, everybody. I'm happy to welcome all of you today to second DICE virtual edition of the Colorectal Cancer Screening Summit. As you know, DICE is the European umbrella organization of a large group of national member organizations that offer support to patients with various digestive cancers. Within our network, we have more than 30 national organizations from the WH region Europe. Our mission is to contribute to early diagnosis and decrease mortality from digestive cancers, and to increase overall survival and to improve the quality of life of those that are affected by digestive cancers. We are very happy for the Colorectal Cancer Screening Summit to provide a platform where patients, experts, and policymakers can unite and share best practices, experiences, and policies with the aim of facilitating the work of the screening programs around Europe and bring forward new ideas and relevant content to the table with the ultimate aim to see fewer people suffering from colorectal cancer across Europe. With the ongoing COVID-19 pandemics, we feel this is more important than ever because the health of a nation is an asset and also because the cancer cannot wait. Today, you will have the opportunity to listen to the experts taking the floor to discuss how we can design and build effective and robust colorectal cancer screening programs across Europe. We will also discuss the challenges encountered by screening programs in the past 2 years under the impact of COVID-19 pandemic and what solutions have been found to overcome them. DICE is grateful for the work the EU institutions are undertaking in the area of prevention. At DICE, we are looking forward to continue our productive relationship, especially in light of the work on screening that has been announced by the Commission in the Beating Cancer Plan Roadmap. DICE is currently leading a stakeholder network in the health policy platform on colorectal cancer screening, and we are looking forward to participating in the work of the 3 thematic groups: early detection, diagnosis, and treatment, research, innovation, and digitalization, and reducing inequalities within the Beating Cancer Stakeholder Contact Group. Our joint statement, presented officially at the beginning of the year, contains a number of recommendations, including asking the EU institutions and EU member states to invest in screening programs at the forefront of their health-related priorities, and for the EU to support member states to share and apply best practices in the field of screening. Slovenia provides one of the best examples of screening practices in Europe. As the Slovenian presidency of the EU Council comes to a close, I am happy to welcome several speakers with diverse expertise who will provide us with different and complementary perspectives on the current situation in Slovenia and what needs to be done to improve screening practices and to overcome the obstacles posed by COVID-19. In particular, I would like to welcome Samo Podgornik, a patient representative from Slovenia, who will share his experience on the colorectal cancer program. I would like to conclude by thanking all speakers and panelists for their support and great work in the field, and give the floor to DICE Acting Chair Iga Rawicka. Iga acts as a representative of our Polish member organization, Europa Colon Polska. In this capacity, she offers us invaluable advice from the national member perspective. Iga, the floor is yours.
Thank you, Zorana. Good morning, everyone. I wish to join Zorana in thanking each and every one of you for being here with us today. This event marks our second edition of the Colorectal Cancer Screening Summit that last year brought together policymakers, experts, and patients' representatives, and we are proud to be able to host it again today with all of you, unfortunately only virtually. We are very pleased to be able to welcome those of you that have been with us for a long time now, as well as those who are new and with whom we hope to start very fruitful partnerships. The event will be divided into 3 panel discussions that will concentrate on key topics relevant to CRC screening. We aim at finding common ground on how to design and build an effective and robust CRC screening program, the impact of the COVID-19 pandemic on programs in Europe, and what the institutions can do to support the efforts of the experts on the ground. Every year, around 540,000 Europeans are diagnosed with colorectal cancer, and a total of 259,000 die each year in Europe, of which 160,000 only in European Union. We believe that significant progress can be made by organizing screening and cancer care in a more effective and efficient way. In Poland, where I come from, in 2018, there were nearly 19,000 new cases, of which over 12,400 patients died. It means that every day, 34 people died because of colorectal cancer, which is fully preventable. 20% CRC screening rate in Poland is far below compared to 60 to 80% in Scandinavian countries. We need to change it, and we need to act now. We believe that lives and money can be saved through finding an EU approach that includes the sharing of the best practice and that encourages member states to raise the investment in screening programs. We urge the use of multidisciplinary approach, critical to run a successful screening program, including psychosocial aspects, information systems, good monitoring and feedback. Actually, cultural aspect is also very important in each country of Europe. On behalf of DICE, we are pleased to welcome the initiatives announced by the European Commission in the Beating Cancer Plan earlier this year, and we look forward to work with the institutions in the coming years. I am happy to see that representatives of the institutions will be present at today's summit, and I wish to thank the Commissioner for Health, Stella Kyriakides, for agreeing to open our summit today, and to John F. Ryan, Director of Public Health of DG Sante, who will participate in the discussion in our 3rd panel. It is my great pleasure again that I welcome each and every one of you to our event today. If you have any questions, suggestions, or need clarifications, please do not hesitate to contact DICE team throughout the chat. And now I am pleased to give back the floor to the event moderator, Tamsin Rose, and thank you very much.
Thank you, Iga, for setting out for us both the added benefit of working together at European level and what we're going to discuss this afternoon. And you shared with us some quite sobering statistics that the screening levels range from the highs of 80% down to the lows of 20%. And I think that gives us a clear indication of what could be addressed at European level and the potential lives saved if we could increase the lowest levels of screening closer to the highest levels of screening.